Okay, we are live. Hello, everyone. So I will do our little opening script. So today is November 24th. The time is 11:04, and the meeting of the Greater Boroughs Partnership for Health Advisory Board is now called to order. My name is Isabella Caruso, the chair of the advisory board. This open meeting of the GBPH Advisory Board is being conducted remotely, consistent with Chapter 2 of the Acts of 2025 relative to extending COVID-19 measures adopted during the state of emergency. All members of the GBPH Advisory Board are allowed and encouraged to participate remotely. The act allows the GBPH Advisory Board to meet remotely so long as reasonable public access is afforded so that the public can follow along with deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream may do so by visiting Northborough Media Connection on the YouTube link on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So with that, we have a quorum. We have Taylor from Southborough, Jen from Westborough, and then Michaela as our shared service coordinator. Anne Marie from Boylston could not join us today. All right, Michaela.
Well done.
That was a
That was a
lot.
lot.
Huh?
Get me to share my screening.
Yes, let me know if you can't.
I think I should be able to. Can you see that?
Yes.
Okay, good. So go ahead and get started. This is just the agenda sent out beforehand. So we'll go through some vaccine clinic updates, talk about shared services, do a brief contact tracing grant update, talking about COVID and flu test, and then talk about our strategic plan update, and then always close with meeting minutes and next meeting dates. So just a quick update. We're almost kind of towards the end of our busy flu vaccine season. At the beginning, we had 420 vaccine doses from salmon. We've done a total of 10 clinics since starting kind of from September to now. 5 homebound vaccines. We've given a total of 379 vaccines. Currently, we don't necessarily have any new clinics coming up or any vaccines scheduled, and we still have 41 doses left. So if there's any ideas for other kind of last minute clinics, or if you know of anyone that is still interested, staff or residents, we can definitely work to kind of do some walk-ins or anything like that. So I will pause here if anybody has any ideas. Happy to hear them on getting the rest of those vaccine doses administered.
My only thought is maybe housing authorities. I don't know if they would be interested, or if they even have like a community space, but looking at the different towns to see if there would be any interest.
Yeah, I bet you Westboro, since we already do blood pressure clinics there,
Okay.
that'd be great.
It's on my to-do to at least reach out to Penny, but we would use high dose at our housing.
Got it.
Yeah, we can definitely look into that and start reaching out. I can follow up with everyone afterwards as well. But yeah, so far, done a pretty good job of using up the doses that we have, so that's exciting. Now talking about public health excellence grant, so I will pass it to Isabella first to do a hiring update.
I got scared. I was like, wait, what am I updating? So the regional public health agent, or sorry, the regional health agent position has been posted for a little over a month now. So Jen and I did a couple interviews 2 weeks ago before the MHOA conference, and we actually have 4 more this afternoon. So hopefully, I know it's the holidays, but hopefully we'll have a offer and a kind of timeline for when they're going to start soon. Jen, do you have anything else?
Um, no, it was just interesting interviews, that's all. So we're hoping these next four is going to be better.
Fingers crossed.
Yes.
And then once we have a candidate, we will make a plan for, if any trainings need to be done, we would utilize our regional training hub in Needham, as well as surrounding towns, you all, but also other surrounding towns for any shadowing opportunities. Perfect.
Awesome. Well, good luck this afternoon. Hopefully it goes well. Um, Talking a little bit more, this is a busy slide, but this is kind of just a overview of where we're at with our work plan in total. We've already got a lot of things done and checked off the list. A lot of those are kind of some of the grant administration items. We've already sent the annual report and annual notification to the four towns. We still have 100% Maven coverage. We checked off one thing, discussing some of our FPHS report results in our July meeting. We've translated the community guides. So we've done a lot of stuff. These slides will be sent out so you can read all the, the items if you're curious. We still have some things that we're working on. So those SOPs kind of outlining shared services, communication, collaboration, a lot of those are being drafted right now. Kind of implementing some more streamlined requesting processes, continuing to translate educational materials is still on our list, and then really trying to improve um, and build partnerships, especially focused on maternal and child health. That one still kind of trying to figure out the landscape there. Um, and then this not started category is mainly because either it was dated for kind of later in our work plan, so maybe more in the spring, or mainly due to DPH shifting some of the timelines. So some of the SAFE 2.0 reporting and metric has been kind of shifted for now until later. So there will be more updates on that in coming months. But for now, just kind of want to show that we've got a lot done and still working on a lot of things. So any questions before I kind of keep moving along? Any questions about the work plan?
No, looks good.
Awesome. So one of those things that we're still working on is requesting services and trying to kind of have a more streamlined way to do that. This form was created last year. I forgot about it. You may have also forgotten about it. But kind of want to try to keep using this. So you can either scan the QR code or I'll send out the link afterwards for people to bookmark. But anytime you need any type of service, this is a good way for us to kind of keep track of what we're doing and what needs to get done. I'll get an email as soon as this form is completed, and then we can follow up that way. So just kind of a way to keep track of what we're doing, what needs arise, in a way that we can keep track of. So if you,
Just a question.
yes, yeah.
Is that what you're gonna say? Or sorry, I thought you were
Oh
done.
yeah, I was gonna open it up, so go ahead.
Oh, okay. This is saying like if you wanted a food inspection like on top of
What we
like
already have.
required.
Yes, yeah. So this would be anything that you don't you don't necessarily have to request a blood pressure clinic or something like that that's already being routinely done. This would be like if your inspector is going to be out and you know you need an inspection or kind of those things that come up as needed, if that makes sense.
Okay, so like if we had like a complaint at a restaurant, I would fill this out for a food inspection. It wouldn't be like our annual or biannual food
Exactly.
inspections.
Yes.
Okay.
Yes. Yeah. Yeah.
And then same thing with case investigations. Like right now, obviously Greater Boroughs staff is doing most of my cases, so I wouldn't have to start checking that off.
Yes. Yeah. If it's something, or like say you wanted to expand, there's like case investigation we're already doing, but if there
Right.
was something else you wanted to add on to that, um, and just want to start that conversation, you can fill this out. Or if it's more of an acute, like an immediate case comes up, um, and it wasn't normally covered, then you can add that on, if that makes sense.
Okay.
And this is also part of our work plan of like testing this out, piloting it. If this
Yeah, of
process
course.
doesn't work, we can always talk about what would be the best way to do that. This is more also just for me to make sure things don't get lost in my inbox if you email me.
To easily track. No,
Yeah.
I think it's a good idea to easily track. I just for myself am like, okay, I'm gonna have to remember to do this every time.
I know, that's what I was thinking.
Yeah, it's not for routine services. It is if you wanted to add on additional routine services and look at starting that process, you could fill this out. But anything
Like if
you're
I
already
wanted
receiving.
like if I wanted someone you to pull data from Maven for me, like I would fill this out.
Yes, exactly.
Okay.
That's a great
I think
example.
it's more like ad hoc projects. Like sometimes I
Yeah.
like email Michaela a lot. So this is kind of like a me
Yeah.
thing. Like I email her a lot, but I really should do this form so it's easily trackable. Like, hey, can you like, a
So it's
couple
all
weeks
in one
ago.
place.
Yeah.
Exactly. Like the
Yeah.
by heart recall for
Yeah.
the formula. I asked Michaela to create that social media. Like that could have been a this type of request.
Okay. Yeah. I think there's some like questions that will come up, but I don't think they need to be like answered right now. So
Yeah. And as things come up, we can edit this form and make it, like I said, we can adjust it as needed. And you can still email me. This doesn't mean you can't
well, I
email
would
and
say to
ask.
you, like my suggestion would be for us to like actually follow through with it. Is like if I email you for something like and you think it needs to go on the form, like just email me back and say, please put it on the form.
Yes,
I
I
won't be
can definitely do
offended.
ditto.
that. No, I think that sounds good. Even for me, because I also get, I, once I get an email, I'm like, okay, I'll just do it. So yeah, we can
Of
hold each
course.
other accountable in that way.
Because you could say like, I'll do it, but fill out the form. Because I also don't want you to have to fill out the form for me.
Okay. Yeah, I think that sounds good. So we'll see how it goes.
All right, sounds
Feedback is
good.
always welcome.
Yeah.
Um, so speaking of services that we're already providing, this is an overview of since from July through the end of October, our public health nursing services. So in total, there's been 175 residents served in some way, shape, or form through our nursing services. Um, about 30% of the time has been blood pressure clinics, another um, roughly 30, I'm rounding up, vaccine clinics, and then home wellness visits, home vaccines, and a few educational events or presentations. This doesn't necessarily include the office hours that we have at both the Northborough and the Westborough Senior Center on a regular basis. And then at the bottom, you can kind of see just the total number of Maven cases that have been investigated since July. In progress, we're still working on coordinating an intro to breastfeeding workshop. We were going to have one last week, but there was low registration, so we're going to try again for January, February, and hopefully we'll have some more time to promote it and get that circulated, as well as, being past some of the holidays. Penny, Isabella, and I were all trained on my senior center, so that's exciting to get to start utilizing that for tracking and different reporting. Um, and then we've already started scheduling our CPR trainings for 2026. So any questions about nursing services before I move on?
I would just add, just to make sure everyone's communications events in Maven are up to date just with the holidays. So Michaela, I'm sure you can update them if anyone needs you to, but just making sure that's up to date and that there's like secondary backup coverage, which is
Yeah,
usually Michaela and Penny, but
Yeah.
usually tag team. Awesome. And then this update is less exciting because it hasn't changed since the last time we updated, since we're still in the process of hiring, but just kind of an overview. We are still continuing to work with MHOA in Northborough and Boylston on youth compliance checks. And I believe Tier 3 housing has already occurred. So this is just kind of a snapshot of where we were at last time. And then this is where we're at with our kind of end of quarter two budget. So at this point, we'd want to be roughly 30-ish% spent in most categories, except for those things that we take out at the end of the year. So our software contracts, we've already done that. This SSC line is going to be ahead until we kind of max it out, and then we'll switch over to contact tracing for the rest of the year. We're doing good on spending for health communications through translating and printing different materials. Our salmon contract is kind of on track. We had a more per diem hours in October due to the vaccine clinics. And then kind of the rest of the categories are looking pretty good. Training, as always, we have plenty of funds available for special trainings that you want to do, or if you see any that you come across that your town budgets won't necessarily cover. So we've also had this adjustment with the nursing line item. We're about halfway through the year. So we're leaving some funds if that does become, if we are able to fill that position later. But with that and kind of the remaining epi line that we moved earlier in the year, we have about 41,000 to reallocate in other categories, which we had talked about a strategic plan, and we'll talk about that a little bit later. Any other questions about spending or kind of where we're at, or any ideas on ways to spend funds as we move forward?
I would just say the nursing supplies, it looks very underspent, but I just want to keep in mind that we typically buy EpiPens at the end of the year for the regional clinics.
Where is the hoarding under this?
That is in we moved that to contact tracing, right? Is it that?
No, I think it's under, I can double check, Jen.
Has anyone used them yet?
I emailed them a couple, maybe it was a month ago at this point. I don't know if I heard back because I asked for updated data, so I will reach out again. I know we give out the phone number. I don't know how many times the resident wants the service. What about you? Have you referred that number?
Yes.
Okay. Well, good to know. Good to know that we have it, but it would be helpful. I will get that information on like utilization.
And if it's not in contact tracing, it will probably be totaled in consultant.
That's what I was thinking, Michaela.
Consult with them. So we'll double check that line item.
So nursing, excuse me. Well, I thought we bought our EpiPens for this fiscal year. Didn't we do
Yes,
that?
at the end of this fiscal year, won't we buy additional ones because they'll be expired?
Right, but I'm just asking because it says that, oh, this is only Q2 spending. Never mind.
Well, this is from July to now, so this is cumulative, but we bought the EpiPens that we're using this year
In
at
June.
the very end of,
Okay.
So it was on last fiscal year.
Okay. All right. That makes more sense because I was like, I thought we just bought those.
We did. Yes, we did just buy them,
okay.
but it was
All right.
technically
In
end
June.
of last one.
Got it.
Yeah. Which will probably try to do the same thing.
Yeah,
this
no,
year.
that makes sense. All right, cool.
So, you'd like us to come up with better ideas on how to spend more money, basically. We always have a problem.
We have a good heading with the strategic plan. I think that'll be a really good way if we continue on with that process to spend down a lot of these funds. We can always, our burn rate for health communications is pretty fast, so we can always reallocate some of it to that and kind of like we did last year, find ways to print materials. But yes, with hiring kind of at the rate it's going, any ideas are always welcome. And some of this too, like training, we should be able to spend a little bit more like we did at the end of last year with MHOA Early Bird or those types of conference early birds that we can squeeze in to the end of the fiscal year.
I feel like we're in a better place than we usually are, though.
I would say overall things are moving along pretty well, especially now that we're thinking about the strategic plan and getting that started early. I think we can make good headway.
Good.
So, yeah. we'll keep.
I like the color coding. Thank you, Michaela.
Yeah.
Thank you. Excel does a great job. And then I put it in Canva and it makes it so much prettier. Okay, so speaking of spending funds, we had looked at translating some of the respiratory information documents. So if you haven't seen these, I've attached a couple of them on the biweekly updates, but it's just tips on, how to stay healthy, also overviews about the different types of vaccines. Um, so this was the quoted amount for all four languages for these resources. So before kind of spending that amount on translating, wanted to get feedback. We can adjust what we translate or what languages we do if this is too much, but kind of want to open it up for discussion.
How are you planning on utilizing it? Like, would you be just mostly using it for social media messaging or?
I would think so. I haven't necessarily looked into getting these printed.
I was gonna say I would not be in favor of printing them, but
I think the
um
season's so short that circulating the printed materials would kind of be
yeah.
at the end. But yeah, mainly online was my thought, unless
Okay.
there's other ideas.
Is is there a date need to be on them so we can reuse them? Because
That's
I
a
feel
good,
like it's
like,
just general information.
yeah. I think I can double check some of the vaccine ones, especially because the COVID-19 vaccine, that one might be more specific to kind of what we had for this year. But certainly the tips on how to stay healthy, flu vaccine generally stays pretty standard. But yeah, I can edit them to make sure they're reusable and take the date off.
So I move to approve funds being spent on translation documents.
Second.
All those in favor, Westboro,
Yes.
Southboro,
Yep.
Northboro, aye.
Awesome. So I'll start working, and usually they're pretty quick turnaround, so hopefully we'll have those soon.
Perfect.
So, speaking of kind of respiratory season vaccine updates, this is from October 9th, so it's been a little bit. Just kind of wanted to add it as a note. They did update the allowable expenses for this year to include the purchase of vaccines. We're kind of towards the end of it, so I don't know if this still applies, but just wanted to make sure to kind of provide this update. You do have to be actively enrolled as a vaccine program, have an established reimbursement process, and a revolving account in order to qualify to use PHE funds for this. So again, this is more of just kind of to note it. And if there's any discussion on it, happy to talk through it if this is something anybody wants to pursue this year.
Um, I think it's a good idea in theory, but I think it's a little late for respiratory vaccines for us to get an effective amount of people to be able
Yeah.
to utilize whatever we purchase.
Yeah.
Was there certain vaccines that were called out or?
It's a good question. I think it was mainly flu and
It might have been
Okay.
flu and COVID. I don't remember a list.
All right, then I'm
Yeah.
definitely not interested.
Okay.
yeah. I
Jen,
think
do you
this,
have-
yeah.
Go ahead,
Sorry.
Michaela.
Oh no, I was gonna open it up.
Jen, do you have any feedback on this?
No.
Okay.
I kind of agree with Taylor.
I think where we still have excess vaccine. I mean, it's not a lot, luckily, but we should prioritize that. And then I think it's so late in the season that we're going to struggle getting rid of those last 40 doses. So
Absolutely. Yeah, this kind of came in later than
yeah,
is necessarily super useful. So we'll see if they keep that for next year. And again, this is a request form for purchases. So similar to the requesting of services, if you have anything you would like to purchase, whether that be nursing supplies, inspection supplies, specific materials, anything like that. You can complete this form, which is a little bit more specific about allowable expenses and kind of, again, another way for us to keep track of what we're doing. Um, so any questions about this? This link will be sent out as well.
This is more like tangible items.
Yes, so this would be anything that we have to pay for, pretty much,
Well,
directly.
okay, but like conferences and things like that.
Yes, yeah.
So you want it all to go through there.
Yes, anything that would have like an invoice or we'd have to
Okay.
kind of pay for.
Michaela, do you know, can you upload files to this or would that be a separate email?
Unfortunately, if I share it with people outside of our organization, we can't do the file upload.
Okay.
So if you do submit this and there's like an invoice or something, either you can just send it to me right after you submit the form, or I'll follow up and ask for it.
Okay.
Okay. Now, contact tracing update. So this should be quick. Last time we talked about using some of those contact tracing funds to purchase COVID/flu test. So this is just kind of a breakdown of some different vendors and the pricing per unit to compare. We looked at both the combined and the tests with only COVID. So want to open it up for discussion about if we still want to do this, if we want to do COVID and flu, and kind of how many we want to order.
I feel like it's with the flu vaccine as well. It's like late in the season.
For test kits.
I do. I don't know. We haven't been getting asked at all for any, which is unusual, but probably the last 3 months, 4 months, we haven't had one question of it. So, I mean, I'll support.
I've had a few asking only about COVID. Yeah, I think it's a good resource, but again, we won't be able to do this in the future. So
Do we have an expiration date on how long it is? I forget. Was it 3 months?
Been a while. I think the newer ones should still, like the new test kits should have the correct expiration date. I think part of that was there were so many with older expiration dates that they kept extending it. But I also haven't
I
ordered
think that's
COVID
just
tests.
something we should know as well before we purchase.
Yeah.
just trying to look it up quickly, but it says 15 to 18-month shelf life, but to Jen's point, it depends on when they ship them and what expiration date they have. Taylor, have you been getting requests?
I mostly get them from employees.
Okay.
But we do occasionally have people who have requests. I did reach out to Safdar about this, who is on my board, Jen. He's a pediatrician. Just to kind of see like what they were doing and what parents were doing. And he said most parents are using the combined tests when their child is sick. And the other question I had is like, what if they like if a parent calls and says, okay, I did like a test kit and it was positive for flu, like are they making them come in the office and like retesting them? And they're not. So if their test is positive at home from one of these types of tests, like they will essentially like treat them over the phone unless they think they need to be seen for symptom reasons.
Yeah, that's good to know.
So I think, having
Definitely
the
ask
antigen
them.
test for flu and COVID could be valuable.
Yeah,
I just don't know, like, because they're so expensive, I don't know how we would advertise that we had them because I don't think we'd get a ton, right? Like if I got let's just say we bought one eye health. Let's just say we did the eye health combined, right? Like if we got one kit for each town, like, okay, I have 50 tests to give to the general public. I don't know. That's my only concern is that they are expensive. So I guess, did you guys talk about your thoughts as far as like how many you would order? Was that something you wanted to discuss here?
Discuss here. Yeah, we just found some of the ones that, we're selling in bulk. But
Was there like a number, like price point that you had in your head or no? Okay, I was just curious.
I think this is contact tracing, so it's not PHE. So we
How
definitely have
much excess funds do we have in contact tracing right now?
a lot,
A
over
lot.
100,000. But again,
Over what?
100,000, but they
Oh,
have to be for respiratory disease related.
okay, so we're not really worried about the price then,
No.
if we chose to pursue these.
Right. I would get it approved by Hillary.
Of course.
But
In that case, then I would be in favor of maybe getting like 100 test kits for each person. Flu season hasn't really started yet. If we had a way to advertise that we had them.
I mean, I think each town could also advertise it differently. You might not advertise
Absolutely.
it and just have it, at town hall.
Yeah. I mean, eye health is obviously the more fiscally responsible one. I think with the combined, we might not have the problem of the expiration date, but I would also want to confirm that. I know like town employees don't necessarily care about it because we've been able to explain it, but sometimes with others we've had a hard time explaining that the expiration date is not the real expiration date. So that would be my only thing with the eye health, but what are your thoughts, Isabella?
Yeah, I'm happy to do. I'm glad you reached out to Dr. Medina because I'm not familiar with the combined test. But if he says that they are recommending them and using them and they're, the same sensitivity and specificity as the COVID test, I think that's fine to get. Yeah. Jen, what are your thoughts?
Yeah, I agree. I like that you spoke to the pediatrician as well. And it's nice to know that they're not having to go into the office and retesting after and they're
Yeah,
taking
I mean,
tests.
that's one office, right? But I would have to think that like
You wouldn't want
offices
to
don't want
yeah.
people in the office if they know that they're sick. So
And then Michaela, the way I'm literally like trying to do math right now. So number of kits, that's per 2 tests. Is that correct?
yeah,
I thought
like
it
in
was.
each kit there's 2 tests. So this
Got
would
it. So
be
it's a little misleading the price per test because we wouldn't break open a
It'd
box.
be, yeah, price per kit.
sorry, yeah, that'd be price per kit.
Okay. I was gonna ask that too.
No, but I don't think it is, right? If you do 863 divided by 48, that's $18.
Oh,
So I think it's price per, I think the
So
way
you
you
did do
have
price
it,
per
I
test,
did.
yeah.
Okay, sorry.
I'm just more saying like how they advertise it is interesting.
And were the buy next two, do you want me to look it up quickly?
Yes, I believe they were all 2 kits. I can double check. So I think you ideally would want to do two tests in a row.
I hate this website. Sorry.
Okay.
So yeah, so I just looked at iHealth. So it is, you're right, it's 90 kits, 180 tests, and it's price per test. But I feel like when we're thinking about it, we think of like price per kit.
Yeah, that would make more sense. That makes sense that this is how they break it down because it's like I don't know why.
Yeah. So I think Henry Schein, if you're looking, Taylor, that might actually be cheaper because they might be doing price per kit and not test.
Um, Binex now. This is just influenza. Sorry, their website is not intuitive to use at all, so just give me 1 second. $25 or $340. Is that what it?
Yes.
25 kits. It's one individual test.
So they don't sell them in twos?
They do not. It says Binex now COVID-19/flu A and B test kit with 25 cassettes, 25 swabs, 25 buffer tubes, and 25 caps.
I wonder if
25.
that's for medical use and not personal use because I mean, to my understanding, you're supposed to do testing sequentially.
What do you mean?
Like if you take a test and it's negative, you're supposed to take another
Oh,
test.
take another test.
Yeah.
I mean,
All right.
it doesn't say for medical use only, but I can continue looking offline and see if I can find more options.
What is the general consensus? Do we want to look into this further? Would we like to vote or would we like to hold off?
Um I think Anne Marie was interested when we brought it up last time.
Mhm.
I personally could take it or leave it, but if we need to spend money, I think they would get put to use.
Okay.
Um, so if you do you want to table it but try and get more information in the meantime?
We can do that. Michaela, when's our next meeting though?
Oh, right.
Our next meeting is January 9th.
Okay, that's too late.
So yeah, we could either find a date to have a special meeting on this after we get more information. Or
Could we make a motion? I'm just trying to think. I don't know. I guess we can't vote based off who's not here, right? So I'm take it or leave it. I don't know what other people think. I'll vote however everyone else wants to vote. It seems like probably everyone feels the same way, but
Well, this, I'll move to purchase test kits at the discretion of what is found to be the best cost allowed or found for combined.
Okay, so combined test, how many are we interested in purchasing?
I think around, I mean, obviously not exact, but around 100 per town. I mean, maybe Boylston might want less. I'm not sure, right? But
And I'll
Okay.
add that to my motion.
Okay, so so combined tests.
Is that what everyone else thinks? I mean, I think it gives us enough that like we're not going to be like you asked for one last week. Do you know what I mean?
Mm-hmm. So approximately 100 each. And do we want do we want to give out kits that have 2 tests each, or are we just giving out 1 test?
I think the eye health ones are just a smarter buy,
Okay.
right?
All right. So I will do research, but Jen, if you want to make that motion again, and then I will also approve it with Hillary at the state.
I move to purchase COVID flu combined testing kits, 100 per town, after research of which would be best.
I
According to,
second it.
okay,
And
Okay.
then just for quick discussion, would you ask Hillary if she's had other towns purchase them and what
Yep.
brand? Or if she has
Absolutely.
a recommendation on brand?
Yep. I will email her today.
Okay. And I vote aye.
Okay. All right. All those in favor, Westboro,
aye.
Southboro,
Yes.
Northboro, aye. Okay. Perfect. I will update everyone on this purchase.
Okay, sorry.
That's
To be
okay.
continued. Okay. And then, as we mentioned before, strategic plan update. So hopefully everybody got a chance to at least glance at or received the draft scope of services for our strategic plan that we've talked about doing and getting quotes from vendors. So um, want to discuss the budgeted amount. Right now it says shall not exceed 25,000, which we definitely have the budget to do. Um, but we can talk about kind of that projected amount, also the timeline. In the draft, we're hoping to get it posted by next week and close it after the 16th and hopefully start the process of the strategic plan with our selected vendor by like mid-January. Um, and then we have the specific kind of goals and objectives for the strategic plan outlined, which we can talk about amending as needed, and our specific deliverables that we would like. And then talk about kind of the potential vendors to request a quote from. So that's a lot, but we can maybe start with the budgeted amount and the timeline to get the logistics squared away.
I actually like the timeline.
Okay.
Budget amount, I'm not, I don't have an opinion on it. I think we maybe need to be a little bit more thorough in our objectives. I
Okay.
think, I don't know, it's just so open and ended, I believe, but that's my opinion.
Yeah, we could definitely make that more tailored. I think that was kind of the hope of a draft is throwing out the general concept and then narrowing down specifically what we want. Taylor, any thoughts on budget or timeline first, and then we can dive in.
I agree with Jen, like if we're gonna do it, let's do it.
Mhm.
No reason to drag it out.
Yes.
I think I know there's been other towns that have done this. Do we know how much they spent? Like, what is that like a reasonable ask of 25,000? Or
So Foxborough, their SSA recently did one. Theirs was 25. Some other towns asked for more like specific deliverables that I can't recall right now, but so theirs were almost like double the cost of this. And then I've seen some as like 30, 35. So I think we're in the ballpark. I would probably recommend increasing it to like 30, just to make sure that the vendors that we will send it to 3 through procurement, will bid on this.
So if you have super specific deliverables, the price goes up essentially.
I think they wanted things, I mean, unless from this discussion that we want, I think they wanted more like specific, like tangibles, not really this like 5 year
Okay.
strategic plan. They wanted like document review and things like that.
Okay. All right.
Maybe like regulation overview and things.
Okay.
Yeah, I think the one that I saw that was most expensive was like the document review and like a feasibility assessment, like very detailed sustainability
Okay.
assessment.
So that was one of the things that I was gonna say is like sustainability, I think like should be spelt out in it.
Mhm.
Like looking at um like what like our systems, for example, like if some of our funding goes away, right? Let's just say like how would we continue to sustain, let's just say like the relevant software, for example, right? Like obviously hopefully metric will be here, but if it's not, like and there could be a way to say that differently than like being super specific than that, but I think just adding sustainability over, let's just say the next 5 years, right? Because that's what a strategic plan is for. I think that would be important to add.
Yeah, I know we had looked at the RFP that Foxborough did, and they did have some language about um like given grant funding, like assessing sustainability in the future and other ways to incorporate that.
Yeah.
So we can definitely add that language.
Any other more specific kind of objectives or scope of work changes?
That's the only thing that I can think of off the top of my head.
Jen, you had mentioned wanting more fleshed out objectives. Did you have any like specific ones that you felt should be included?
Yeah, currently right now I do not. It was a great, it opened up discussion, but I don't have any answers.
That's okay. I think the sustainability piece is definitely something we can add specific. And Taylor, do you mean more specifically like funding sustainability?
um I think that's an important component, but also like I mean we have had staff turnover, like just infrastructure. I don't know. Or
Yeah.
I mean, you have in there organizational sustainability. So I think just adding like, maybe just what funding either like, our software or, whatever like things that we would, and I don't know that it needs to be spelt out this detailed, but things that we as Greater Boroughs think like, oh my gosh, it would be absolutely horrible if we lost these things, right?
Mm. Yeah.
And like it, and still like this is silly that we're paying for all four towns individually, like after, like if we had to.
Mhm. Yeah, so kind of also assessing some of the benefit or uh, impact of pooling that as a four town
Right.
collaborative. Okay.
Do you need a motion for this today?
I think so. I think we should also talk about any deliverables we are interested in, and then identifying, I would say, 3 to 4 vendors that we would send this to.
Do you have specific deliverables that other people used as examples or?
So I don't have Boroughs, but I think the main goal is the 5-year strategic plan. So
Yeah,
how can we remain sustainable with our regional group while meeting all of the standards for public health?
yep. I mean, that's like the most important piece of it, obviously.
I did add under 3.1 a presentation with the final recommendations, which would be a Greater Boroughs Advisory Board meeting. So we would have that live streamed and recorded. And then I'm sure they would compile the interviews with, shared staff and health departments of our collaborative.
Yeah, I think that is like a piece of like doing the strategic plan, but
And the hope would
Did-
be that it would be done so that we could incorporate it in our work plan for next year.
um,
Any other deliverables?
No, I don't right now.
Taylor, any other deliverables for you?
I mean, maybe, but I can't, I would need to think about it.
Okay,
Mhm.
Sorry.
totally
That's
okay.
okay.
So do we want to think about this and schedule another meeting for December? It would put the timeline off a month if we're not comfortable like with this draft and we want to kind of come back to it.
So I'm out the month of December.
Okay. Good to know.
Unless it's gonna be Monday or Tuesday of next week. I don't think we can get a meeting in that quick though.
Actually, yeah, I don't even think we could
Oh,
get
with the
the
holiday
agenda
and
posted in
posting.
time.
Hmm.
That'd be faster. I mean,
I mean, if we had a quorum with Anne Marie, we could do that. But it's up to you.
is it, because I'm not super familiar with open meeting law, would it be a problem if, like, Jen, you emailed your feedback before the meeting and then we presented it in the meeting, or does that not
I
work?
think she can email it to you, Michaela, and then, but like if she wasn't present for the vote, she wouldn't be able to vote on it, but
It depends on when you have it. I can also, I can attend remotely.
All right, so are we leaning towards that? Think about it, look at other strategic plans.
I just like the timeline, so it kind of stinks that we're
I know. I
postponing.
would kind of, I almost am like willing to kind of sacrifice and maybe just have a little room in the budget to like add some deliverables after the fact. I don't know. Is that an option?
No, I
Like
don't think so.
I don't.
obviously but if the RFP is more open-ended, like it kind of is now, I don't know.
Fortunately, once they put their
Yeah, okay.
response in,
Yeah, we can't change it because then it wouldn't be fair. Yeah. All right. Um,
I
Let's
am,
hold off. Let's everyone mull this over. We will find a time in early December. Jen, we will try to coordinate with you if possible. And then we'll make a final vote in December.
If you can make it 2 weeks into December, it'd probably be best
Okay.
on my end, but don't hold anything up for me.
Do we want to just find a time right now and then we'll run it by Anne Marie?
Sure.
Yeah. Jen, you're saying the week of the 15th would probably be best?
Yes.
So the third
I'm
week?
wide open, so.
Well, as long as you're feeling up to it. I could do the 18th. It's a Thursday.
I can't from 10 to 12, but other than that, I can.
Yeah, I'm also available except for 10 to 12. Do people have a preference of morning or afternoon on the
No.
18th?
I don't. I have a 3 p.m.
Do we want to do one?
Sure.
All right,
That's great.
let's pencil that in. Michaela, can you email Anne Marie?
Oh. Yes. Sorry, that's me creating the calendar.
I'm like, what did I press?
Nope, that's me. Yes, I will let Anne Marie know and see if she's available.
Perfect.
Okay. So we'll go through that. Maybe would that also be a good time to kind of continue the conversation about vendors so people
Well, I
have
think
time
if we
to.
have vendors off the top of our head, like I don't know if people do or not, but we could get them out of the way.
I like CMRPC.
Yep, we've used them for our health and human service strategic plan.
MAPHN right now is using BME strategies for their strategic plan, and it's going well.
Okay.
I like them as well, so.
Yeah.
And then
Do you have a list of vendors, Isabella?
let's see. I'm not as familiar with these groups, but HRIA.
We've used them before for other things. They're okay.
Okay. JSI. I don't know if they
JSI.
even do, I would have to do more research to see if they do local public health.
They do.
Like,
We're using them right now for FEP, for not strategic planning, but for something different, and they're pretty large. So I don't know. I mean, I think more the question would be like if they do strategic planning, but they definitely do local public health
Okay.
work.
Okay, so we can finalize the list once we finish the draft, but I think that is a good plan. And then once we have it in December, we'll submit it, find new dates, and as long as we can start, February, we'll have February, March, April, May. And as long as it's done the end of May, so 4 months.
Okay. And then do you want to change the cost to
30.
30?
Yeah.
Yep,
Okay.
we'll make those changes and then Michaela can send that out as well.
Yeah, and I'll update it with some potential sustainability language, and send out a new draft ahead of whenever we meet.
Great.
Or the 18th.
And it's totally my fault. I looked at it like this morning at 9, so I didn't really have time to think of specific deliverables, so I apologize.
I apologize as well. It's not on you. You guys sent it out. I just haven't had a moment to look at it.
It's okay. It's especially the Monday morning trying to get the week started. I get it.
But I do need to sign off
Okay.
if I go on a quorum, so I don't
Yeah,
know
so
what
let's
else we have.
just maybe Michaela skip to the end, just
Yeah,
so.
we don't have anything else except for the meeting minutes, and
Okay.
then we're done.
All right, did everyone get the minutes?
Yeah,
Yes.
I reviewed them.
Okay, I make a motion to approve the September 9th and the September 29th meeting minutes for the Greater Boroughs Advisory Board
Second.
meetings. All those in favor? Jen?
Aye.
Taylor?
Yep.
Isabella? Aye. Perfect. We will get those posted on the Northborough website.
Perfect.
And then we now have our date on December 18th at 1. We will confirm with Anne Marie and then we are good to go.
Perfect.
Great.
Awesome.
Thank you, everybody.
Thank you.
Thank you.
I make a motion to adjourn the meeting at 12:04.
Second.
Second.
All those in favor, Jen,
Aye.
Taylor,
Yep.
Isabella, I. Have a lovely Thanksgiving, everyone.
Yes,
Bye,
happy
everyone.